Today is April the 4th, and it's significant in a lot of different ways. One of which is that this is the 50th anniversary of the death of Dr. Martin Luther King Jr. And I'm going to tie that in for you. Let me quote something that he said. Of all the forms of inequality, injustice in healthcare is the most shocking and inhumane. Of all the forms of inequality, injustice in healthcare is the most shocking and inhumane. So I think it's more than a little befitting that I center a conversation around efforts to address inequality in healthcare. And I think it's also befitting that I have two individuals on this show today who can assist me in imparting information to the community about how one organization in our community is trying to address the inhumanity of the inequality in healthcare, which I'm happy to know, frankly, that there are efforts in our community to address these problems and to give everybody, irrespective of their ethnicity, income, or sexual preference, if you please, everybody the opportunity to the best extent possible to have access to health care. This is a call to action.
A call to action.
I'm your host, Alex Habersham, and I'm pleased today to have with me Ms. Caricia Vostor, who's the supervisor at Healthy Communities, and Mr. Albert McQueen, who's a senior vice president at Navicent Health. Both of these fine people work at Navicent Health. So there's a lot going on in our world and in the community, but I can't think of many things, if anything, that's more important than health care and access to health care. And for years, Dr. King even realized that 50 years ago that inequality in health care is inhumane. And I'm just pleased to know that there is an entity through Navicent Health that's addressing this, and it's called Healthy Communities. So talk a little bit, if you would, Albert, about just the general concept of healthy communities and what you're trying to accomplish with that.
Absolutely, and thank you for having us. Pleased to be here. But, Navicent Health and our predecessor organization, the Medical Center, all the way back to Macon Hospital, we're the safety net hospital for not only Macon Bibb, but, all of Central Georgia. And so for years, we really had a commitment to elevating the health status of our people. We believe that's a basic right for all individuals. Everybody wakes up in the morning, doesn't say, I want to be sick today, or I want to be incapacitated. We want to be well. It's one of our basic needs. And so for years, we've done things like community health fairs and health screenings and all kind of efforts, making ourselves available so people have increased knowledge about what they can do about their health status. But I would say 3 or 4 years ago, we really started ramping this up in a more organized way, in part brought about by federal legislation that required all nonprofit hospitals to conduct a community health needs assessment, which we're doing again this year. We're getting ready to start. And in that, it finds what are the key findings for the people we serve. And some of the key ones, we've got a lot of chronic health conditions, diabetes, hypertension, COPD. A lot of those are controllable if people access care early and at the right time. But the number one finding was that just clear access to care, and it could be like a transportation, it could be like a knowledge how to get there, not enough physician providers, and they're not distributed well. They're not distributed in the same way throughout all of our community.
Yes, sir.
So some of our areas that have higher poverty challenges have poor access to care. So some may have insurance, some may not have insurance. So it became incumbent upon us to find ways to help them get what they need so they're not relying upon our emergency room. We want the emergency room to be there for true emergencies. Yeah. Our trauma center gets patients from all over the state. So we formed Health to Communities as one of our 4 building blocks, I guess officially 2 years ago, and started looking who are the community partners that we can join forces with that can help us address some of the issues affecting healthcare, but they're really not the provision of healthcare that's going to fix it. Access is, but we've got to help people get access to better nutrition. We want to help people get out of poverty, and that's very much ties into people having healthcare. So Caricia and some of her colleagues are known as our Health and Community Case Managers, and they're involved in various activities, and I'll let you fill in on some. And really for the entire population, but we're very focused on the sections of our community that have the larger challenges.
And I talked with
Dr. Gilbreth.
Dr. Gilbreth this morning, and he talked some about health disparity.
Absolutely.
You know, and the Navicent's efforts to address the inequality and, you know, inequities that are persistent in the system today. So I was happy to know that not only from a philosophical perspective, that it's being realized that there are disparities and some inequities as it relates to health and health care. So I was glad to hear that, and I'm also glad to hear about that. So when you say community partners, Caricia, who are some of those? What I want to do, first of all, we want to acknowledge, you know, the partners.
Absolutely.
And promote them and let people know about them. Then I'm going to rely on you to talk about some of the specific steps and processes that are being taken to address some of the more chronic illnesses like diabetes and COPD and heart
failure
and heart disease. And I guess COPD, you know, for a long time, I hate to tell you, I didn't know what that meant. But it has to do with respiratory problems. So talk a little bit about the partnerships and who some of the partners are.
Well, we are very grateful for all the people that inside the Macon Bibb community that wants to partner with us, starting with First Choice Primary. We have First Choice Primary that we try to partner with. We're inside the hospital as well. So for the patients that do not have a provider, we try to link them with different providers in the community. So First Choice Primary is one of those.
And that's our local federally qualified health center that's been operational for about 10 years.
First Choice
Primary Care, yes. It's a primary care physician practice that is in part funded by HRSA, that gives them some grant funds because they serve people on a sliding scale fee, so they have a lot of uninsured people, a lot of Medicaid patients and Medicare patients, some of whom can't get access into a general community doctor. So they have the Walnut Street location. They have a school-based clinic at Ingram Pie. They have a clinic inside the health department over on Emory to help make primary care available for behavioral health patients who are there being seen by River Edge. Then last year we provided them a community grant that enabled them to acquire South Macon Family Physician on Houston Avenue, where Dr. Bill Brooks had practiced for years and years and years. Yeah. And he was looking toward retirement, and he simply, I guess, could have shut the door, but then that would have been 4,000 or 5,000 people who rely on him. A lot of them who walked to his office. We gave him the funds. He's now under the umbrella of First Choice, still working a little bit. He's scaled back, I think, one day. And
he's still seeing patients.
Still seeing patients.
Wow.
He will for a number of years, but we've put a nurse practitioner in there with him now. And so that practice will continue even when Dr. Brooks gets to his deserved retirement. So, and they have a clinic in Houston County also. Right. So, but they've got people that are based in Navicent who are screening patients of these high-risk patients who don't have a primary care physician and trying to get them back within a week after being discharged from Navicent. To make sure they understood what happened, reconcile their medications, because healthcare delivery is very confusing these days. I mean, it's hard for people to fully understand, even if we're using the right words. Sometimes we realize we use terms that people don't understand, and we've got to make sure that they do understand what their responsibility is and what their medications are for, and if they can't get them, people like Carissa can help sometimes find them sources.
Now, are the partnerships limited to medical and health related?
It's not. And so
are there other ones?
Yes, absolutely. We're also partnering.
You thought I'd never ask you.
We're also partnering with Daybreak. We partner with Mission United through the United Way. We're also partnering with the Macon Food Bank because it's important that nutrition is a part of that. My most recent partnership is with One South with Danny Glover. So I'm excited about that one because there's a lot that can be done with just making sure that the community can get access to healthy food. So hopefully those partnerships will continue to grow. We have the med law as well because sometimes there's issues that is not necessarily medically related, but it's affecting their health. So for example, let's just say that a patient is in an apartment or housing where there is issues regarding mold or something that might be affecting their health, COPD. Well, if they're in the hospital and they
or asthma for such a child.
Asthma as well, yes, absolutely. So we also have the med law services that can help with that. And
that's a partnership with us, Georgia Legal Services, and Mercer School of Law,
right.
Where there's an attorney based in Navicent who gets referrals from physicians and case managers that this is a situation that really needs a legal solution to so their health status can be realized, improved.
Yeah.
There's also the faith-based one as well because that's also an important piece of it. We want to make sure to partner with the different churches. So we have a toolkit that we try to find out all the different churches, what are the biggest healthcare issues that they have. And so we partner with places like Bethel Church so that we can make sure that if there's
Pilgrim Missionary.
So there's
y'all did a great job putting that together. I mean, it's really a wonderful in a box where it's got fact sheets on all of the key chronic conditions. It's got information to whoever the church member that's going to be running the screening program. Some of our churches are already pretty well advanced, have what's called a parish nurse program where they've got members of their church who are healthcare professionals or retired. And on Wednesday night gatherings or whatever, they'll make themselves available to do blood pressure checks and things like that to just help people monitor their condition. And if it starts trending badly, then intervene and get them referrals. And we really wish every church in Bibb County would take advantage of that. It's free. You can get it off our website.
You said a toolkit.
Yes.
So describe that toolkit. So, I mean, if there's a church in the community that's concerned about the health of the parishioners or churchgoers, then they can partner with healthy communities to see if, in fact, they can initiate some kind of program and activity that can help to address. Let me tell you why this makes me happy. Because information is powerful, and a lot of the disparity is a result of the lack of information. So if in fact, and that's part of the mission of this program, is to educate the community to the extent that the community knows the resources that are available to them. And there is no more important resource outside of spiritual, and I don't want to get into religion, other than health. So I think that's extremely important. So in addition to the toolkit, talk a little about, I heard Albert say that you were a caseworker. So I mean, so you all, it's kind of like the rubber meeting the road.
She's a miracle worker.
I partner with lots of great people as a care coordinator to get that done.
Strangely enough, Dr. Gilbreth called her a miracle worker also. So he was in agreement with that.
I work with a fantastic team, but I am a care coordinator with Healthy Communities. So what that means is that I assist not just the patient, but the patient's family, the patient's physician, because this morning I went to 2 different doctor's appointments with my patient. We talked a little bit about that, that understanding of the information. Health literacy is such a big part of what we do. We need to make sure that the information the doctor is giving to the patient is being heard, received, and then knowing what to do with that information. So I hear what the doctor is saying when I go to those appointments, and I help the patient to understand, tell me what is your understanding about what the doctor just said. Because sometimes, the doctor's language goes over patients' heads, and sometimes they'll say, well, it's just easier to say yes, because I don't want to show that.
They don't want to be embarrassed by saying, I don't know what you're talking about.
Right.
And it's being able to help them find the voice that saying, I don't know. This is my body. I want to be a part of this conversation that's happening with me. So being able to help them find that voice that says, I want to be a part of this conversation. I want to be at the table when you're talking about my health, because that's important to me. So as a care coordinator, I'm with the patient, with the family, with the doctor, with the community, and being able to even say, who's on your team? We're playing a team here. Who's on your team? Because it's going to be the family, the doctor, the nurses, the pharmacy, the pastor, everybody who touches that patient. I want their voices about that patient as well. And having the patient say, I need to know who to call when my life is not going well.
Right.
If I'm having a spiritual issue, who's your pastor? If I'm having a medical issue, who's your doctor? You have a pharmacy issue, who's your pharmacist? What else is in the community that can help you? If you have a transportation issue, who can you call? I was talking, sorry.
No, good. Yeah, she is a miracle. So what you're basically saying is that healthy communities, from a health perspective, is almost like a one-stop shop. From a healthy perspective, from an health education perspective.
Right.
Would you say that?
I said that we don't do it all.
No, we can't.
We can't.
Like, we can't build apartments. Navicent doesn't build
Yeah,
apartments.
I know that.
But we partner with the Macon Bibb Housing Authority over Tyndall Fields,
right,
which is a fabulous redevelopment of a former public housing that
Absolutely.
first phase just opened up. But
I grew up.
You grew up there, and that's
project.
where the agri-hood's going to be.
Yeah.
Too. So, but yeah, we worked with United Way, with Mercer. Of course, it was a multifaceted because they applied for an application with the Department of Community Affairs to get tax credit financing on some of that development. But they had to put together a plan that included efforts to create jobs, address transportation, education, and healthcare. So we did the healthcare part of that with Mercer. We canvassed the neighbors. Of course, Ingram Pie, the clinic First Choice has, is right there at Felton, right below Felton Homes, and helped the Housing Authority submit that application. It was the highest ranked application. It was a competitive deal around the state, and Macon Bibbs was number 1 and got the funding to do that. So we're going to place one of Caricia's, or maybe you, I don't know. We're going to put a community health worker inside Tyndall Fields.
Oh, wow.
When the next phase gets built, because it's going to have a little community building. So we believe if we can help, enjoin neighbors, helping neighbors, we can teach them some basic skills about how to take vital signs. For instance, we partner with Meals on Wheels. Mm-hmm. I mean, they're going into 600 or 700 homes a day, I think, delivering. It's a great organization, by the way. And someone had the idea, why don't we train their volunteers on how to observe and assess if Mr. Jones looks bad this week compared to last week, and then they refer it to one of our community health workers, we can do something about it. So
Wow.
we're also with Bibb Housing Authority. We have a nurse on a scheduled basis in all of our what we call tower medicine, but the Dempsey, St. Paul's, Clisby, McAfee. So she goes into those towers, which are mainly senior people, not exclusively senior people, and provides health screening. and just again kind of eyeballs them, and then if they look like they need something more, try to get them in to see their doctor, or if they don't have a doctor, we got first choice as an option, something besides the emergency room, because that is really not where primary care needs to be delivered.
And that's why it's so important for like places like the Rains Clinic to be able to be
Yeah.
part of the community.
Places like the what?
Well, we have a plan to, and I think you were at the groundbreaking. It's been a little while now, but the Curtis Rains Foundation
Oh, yes.
plans to redevelop that Bell Arbor nursing home, which has been closed for a number of years, into a community health center.
Right.
So Navicent will help First Choice again with the funds to put a primary care clinic in that site, which is another area of need. And there's a lot of great stuff going on in that Bellevue section of Macon right now. The Fillmore Thomas Park was redone. They put the sidewalks in. That's another thing. We have pedestrian safety is a huge issue. We have the highest
I know.
pedestrian.
I know.
You know that from your wife, and so that's another group we've partnered with. We are, I'm blocking on the lady's name, but there's a commission, a pedestrian safety commission, and they've done great things on trying to educate children about safety crossing, and working with Department of Transportation and the Bibb County to create some of our high-risk intersections to be more safe. But we are going to provide a support group for the families who have lost loved ones in pedestrian fatalities.
Wow.
Or survivors, people
Wow.
who've been in a pedestrian event but survived and really need to work through that. So we have a support group that we're starting for that group of folks. So, have you worked with the Shalom Zones? Can you talk about that
That's
some?
Angeline.
Yeah.
We have another one of my wonderful care coordinators, Angeline. She is working with the Shalom Zone, and one of the things she's coming up with a project, and it's for senior walk, so that they can go out and get active and support each other if they do exercise. So that is her passion of just being able to help seniors to support each other as they get a little bit of exercise and just utilize the community and the partnerships and the bonding.
Hey, are you aware of the Shalom Zones?
Yeah, with Frank.
Sure, with Frank also. I mean, he's really done
yeah.
so much of that just on his own, but I think we now have 12, possibly a new one added, but around the whole city. And the mayor, I know, was a big supporter of Shalom Zones. And again, it's like creating a sense of neighborhood about the people that live there, and most of them have a community garden. Again, bringing nutrition opportunities in there. So we have brought in some health education and screening into some of the events the Shalom Zones.
I was really excited to learn about the community garden and Danny Glover's project.
And that's a big vision there.
Yeah, it is a big vision.
But he got a great grant.
$500,000. Yeah, I know.
Yeah.
But it's important, I mean, see, what happens as it relates to improving a community is like when entities that can have a positive effect of the community take the same kind of attitude that Navicent has. Everybody can help in different areas, and you all are doing a good job with health. I'm a firm and a strong believer that most problems can be addressed in a community. And health, of course, is one of the biggest problems in our community. Health disparity. Is a serious problem, and I'm glad that you all are addressing that. Now, Carissa, talk a little bit about, if a person wanted to learn more information about community health healthy communities, if in fact, they've got a problem, just how can your services, since you're the supervisor, be accessed?
Okay. Well, like I said, we have our webpage, and so all the information that we have on our webpage, and I'll be happy to provide that for you. Some of the Navicent webpage, you can go and you can get information regarding our education information regarding our health screens, our health fairs. All the information that we have is available to everyone in the community, so that it's there easily be accessed. But you can also go ahead and reach me at Navicent, of course. If you want our office number, I'll be happy to share that as well.
Go ahead.
Okay, it's 478-633-8109. Again, my name is Carissa Vosh, and I'll be happy to answer any questions, share the information on the website. I'll be happy to come out and talk to the local churches.
Now that's important. Hold on. Let's put a pin in that.
Okay.
Because oftentimes there are groups and organizations looking for speakers, to come in and talk about health care. And it's important that members of groups, know about what you all are doing with healthy community. I got to write this down.
You did?
Healthy community. So you're saying that you will go out and...
There's a speaker bureau that we have for our Charles
Wow.
House, and he takes requests, and then Navicent will work to try to identify staff that can come out and do those. So yes, our speakers bureau is also on the webpage. You can make a request for speakers bureau.
And we can help sometimes find volunteers to help on events. I mean, we offer our own health fairs. I mean, we organize some ourselves, but we really like to work with other people who are doing health
who
fairs.
want to have a health fair.
And this group that started the Ironman
Yeah.
Health Fair 5 years ago was
Danny Borkins and Jimmy Mills.
yeah, absolutely. I mean, we've been their partner for the whole 5 years,
Right.
and it was geared really at the African American male who is very reluctant to seek out health care
Right.
until it's kind of too late sometimes. So they've done great. I can't remember the total number of people they've screened, but for prostate cancer, which is a condition that's very easy to treat if it's caught early on, and they've got a series of block parties that are going to be done is it June, I
I think that's what Charles said.
4 Saturdays in a row in Macon in various locations, probably rec centers, some churches, to really target health screening for men.
Well, that's so very, very important. Is it www.navicenthealth.org?
That's it.
So if one wants to find more information, they can go to the website, and I'm sure there's a tab.
Yes.
To find. Just
I guess you could type in healthy communities in the search bar.
I'll be happy to double check and get that information to you.
Yeah. But they could find it from Navicent Health. If not, just call Carissa Voxtel, who's my guest today, along with Albert McQueen, who's a senior vice president. I want to thank you all for coming. It's been most informative, and like they say, if you take the initiative to be concerned about your health, then there are resources available to answer any question that you may have. This is a call to action.
A call to action.
I'm your host, Alex Haversham. Thank you all again. Have a great day.
You too. Thank you.
www.makingblackpages.com